Hey Bio2, these are the blood vessels that you're going to need to know for your upcoming quiz on Thursday. The first are the arteries. So these are the arteries that you must know. There's 10 of them. I've numbered them for you. So you might just want to make a mental note about these are the 10 that you need to know. Um, so if you kind of look at this for just a second, these are the first six. Kind of confusing just because I think most of you have heard about the aorta. So, the aorta, this big blood vessel, which is the largest blood vessel that we have in the human body, coming off of the heart, we have the ascending, which means it's coming up, then the aortic arch, and then the descending, means it's going down. All right. What's confusing is the aortic arch. Coming off the aortic arch are one, two, three very, very, very important arteries that you're gonna need to know. All right, and this is what usually confuses students. So let me just kind of help you out just a little bit. Of the three, again, when we're talking about the human body, we're looking at a patient. So this is always over here is going to be the right side of the patient and the left side of the patient. Okay. So on the far right side, the first artery coming off of the aortic arch on the far right side is called the brachiocephalic. Break that word down. That's kind of what we've been prepping you for all semester. Brachio means arm, cephalic means head. What that means is this artery is going to then split and go to our arm and our head, and that's exactly what it does. The brachiocephalic artery splits into two other arteries. The right subclavian, which I'll show you here in just a bit, goes down the arm, and the right common carotid goes up to our brain or to our head. All right. The second one is called the left common carotid. So it's going up the left side of the body. In what that means is, like right here in this open space, this is where the trachea and esophagus would be located. So check this out. If you ever have taken your pulse before, the best way to take your pulse is using the left common carotid artery because it's directly connected off the aorta, off the heart. So it's a little bit of a stronger pulse. Whereas the right one has to split its blood to going down the right side of the arm and then going up to the head. Obviously, the head's pretty important with our brain, so it sends two very important arteries that way. On the far left-hand side is the left subclavian artery, and that's going to go to your left arm. Okay. Um, please go over this. Let me show you another slide here. Again, the brachiocephalic has the right carotid and the left subclavian. Then we have the left carotid and the left subclavian. Again, sub means below, clavian means below. Clavian actually means the clavicle. So, we've been trying to prepare you for this all semester long with learning our vocabulary. Here's a nice little picture to kind of see everybody side by side so you can kind of see how that looks like in the human body. If you check that out, can you see how coming off the heart, this is the aortic arch, and there are three structures coming off the aortic arch. The brachiocephalic, the left common carotid artery, and the left subclavian. And you can really see these in a little bit better. Can you see how, a little bit better picture. Can you see like this would be your trachea and your esophagus? So this is your right carotid and your left carotid, and the two subclavians are going down the arm. Okay. Here's just another picture of that aortic arch. You can really see those arms. So you can see the left subclavian, the right subclavian, and the two carotids. So make sure you go over that. Going down the arm, we're on the right side of the arm. Can you see how the right subclavian then goes into that right arm? And then here's the thing about arteries and veins as we go through this. Wherever the vein or artery is located is dependent upon its name. So once we get in the arm for extra credit, The brachial artery is actually in the arm, and then it splits off into two. We go to the radial artery, which is on the thumb side, which is on the radial side, the radius for the bone. And then it's the ulnar artery, which is on the pinky side, which is connected to the ulna. Again, not definitions, but words and suffixes and prefixes really important. So these three here are completely extra credit. Moving down below the diaphragm. Once we get below the diaphragm, that descending aorta then becomes the abdominal aorta. Same artery is just located in the abdominal region. Coming off the abdominal artery the abdominal aorta are lots of other arteries. The ones that you need to know, the only one that you need to know is the renal arteries. And the renal arteries connect to the kidneys right here. Okay, there's other arteries connecting to the liver and some other arteries connecting to your spleen. But you do need to know renal arteries connect to the liver. All right, moving down. Again, one more time, you just get to see those renal arteries one more time, the left and the right. Moving down, what happens to the abdominal aorta is it splits because it has to go eventually into the legs. It splits in the pelvic cavity. And the minute it splits, it becomes the common iliac artery. This would be the right one. This would be the left one. It's called iliac because this is the ilium of our pelvic region, right? We learned that earlier on. So the minute it splits, it's called the iliac artery. And that continues. And then when it gets into our leg, we call it the femoral artery. All right? Sound good? All right, so these are our veins that we need to know. So if we start looking at the veins, some of the veins have very similar terminologies. There's only 8 of them. There's a couple of extra credit ones. So I think everyone's heard of the superior and inferior vena cava. The superior is coming off the top of the heart. The inferior is below the heart and goes all the way down to the abdominal region of your body. What comes off the superior? A couple of different veins. So here we go. So the veins, coming off the superior, the veins split into 2 and then 2 more. The 2 that they split into is the brachiocephalic veins, which means both of these veins here are going to split and go up the head and down the arm. And when they do that, the minute they do that, if they go up to the head, we call them the jugular vein. So here's the right and the left. Again, if they go down the arm, we call that subclavian. So coming off of the brachiocephalic subclavian veins go into the arm. The jugular vein, which is the largest vein you have in your neck there, goes up to your brain. Okay, kind of hooks up with those. It doesn't hook up, but it sits in the same place as the carotid arteries. If you go down the arm, that right subclavian vein, once it hits the arm, it really diverges. It really does a lot of splitting. The only vein I need you to know is this median cubital vein. It goes diagonal. It's right there where the crease is, and this is where you get a venipuncture. So this is what nurses, medical technologies, CNNs, this is what they're always looking for, is that medial cubital vein right here diagonal to get blood out of your body. Going further down, this still remains the inferior vena cava, and again, as we're going into the abdominal region, once we pass the diaphragm, it diverges into lots of different veins. The only vein you need to know are those renal veins going to the kidneys. Okay, anything going to the kidney is referred to as renal. As it divides in the pelvic, it also is called the common iliac vein. 4 extra credit. Here's what you could do. Once it divides, then we have the external, is more on the external side of the body, kind of by those bones. And then the internal iliac goes in the middle, right there, of the pelvic girdle. So if you want to learn those for extra credit, you can. FYI, the arteries would be called the same thing. So this would be the internal iliac artery, and this would be the external iliac artery, FYI. As the vein enters the leg, we call it the femoral vein. Okay, so you can see a nice little picture here. And then also what the vein does is it splits and it becomes, for extra credit, all the way down. It's called the saphenous vein. So if you want to learn that for extra credit, you can. All right. Well, the rest of this PowerPoint is really just you guys practicing. So I have all these diagrams with nothing on them. If you want to practice, this is very much what your quiz is going to look like. These are all the arteries. So you can see I'm pointing to all the red structures, the oxygenated blood arteries. And then I then point to the veins for extra for studying purposes. Extra credit is also being pointed to, like you can see it here and here. If you're having questions, problems, or concerns, please let me know. I'd be more than happy to help you out. But you do need to know all these veins and arteries by by Thursday. So good luck. You got this. We tried to pick the ones that really were the big ones that you might hear of later on in life. Okay, good luck.